Hi folks, this is Dr. Rob Cywes. I am the carb addiction doc. And from a personal perspective, the reason I got into this entire understanding of obesity space and developed an understanding of carbohydrate addiction really came from one of my specialties. Now I am, as you can see, I'm in scrubs. I am a board certified adult general surgeon. And as part of that, I did research in the lab looking at glucose metabolism in the liver, and gave me an understanding of the harm of glucose. But also, I am a board-certified pediatric surgeon. And in dealing with my pediatric population, I do deal from a surgical perspective with a number of kids who have surgical consequences of an addiction to carbohydrates. So they're eating a lot of carbohydrates, they get gallstones, they get polycystic ovarian syndrome, they get ovarian torsion, they get obesity, they get a variety of, and type 2 diabetes, insulin resistance is increasing. They get a variety of diseases early on as young children, as adolescents, autism spectrum disorder, whatever that may be, as a consequence of chronic excessive carbohydrate consumption. So my pediatric surgical career has heavily exposed me to the awful diseases of insulin resistance in kids. And yet, as I started to practice and focus more heavily on obesity and insulin resistance, and I opened up my practice doors to anybody with insulin resistance looking for therapy, my entire practice has shifted away from being primarily focused on children, adolescents, and adults toward being primarily focused on middle-aged and older people. So the majority of my patients that come to me to treat obesity, to treat diabetes, to treat insulin resistance, or to want assistance in tracking their ongoing treatment of that, their arrhythmias, their cardiovascular stuff, their cancers, all of the stuff that are consequence of insulin resistance, are in their late 40s to 70s. And in fact, my current age spectrum is typically the largest segment of my patient population are late 40s to early 70s. So why is it that is my patient demographic? And my patient demographic are primarily not by referral, but they are there because they chose to set up the appointment. They've chosen to seek out therapy. They've chosen me because of some of the content on this channel, and they've chosen to see us. And why do we have so few young people, whether they're obese, whether they're having mental health issues, whether they're diabetic, why do we have so few people under the age of 30 in my practice, even though I'm a pediatric surgeon with huge understanding of some of these needs? Infertility, PCOS, type 2 diabetes, insulin resistance, obesity, overweight, all of those are issues, acne, that plague young people. And yet I don't have them in my practice. Why? And I'm going to explore that in today's video. By the way, if you like what we're talking about here, share it with other people, but please hit the like button and please leave a comment. If you're having that aha moment, if you disagree with what I'm saying, or if you've got advice for me, I'm not an expert. I am a student of this. I'm learning to do better. Leave a comment in the comment section, like us, but also hit the subscribe button, because there's plenty of videos like this, and it helps us to keep this content free. It helps us to grow. I don't benefit fiscally from anything. Okay, so let me circle around a little bit. Now I'm going to read you a letter. And this letter I just received this week, and it was written to me by one of my young patients. That demographic that I hardly see, it's a small fraction of my patient population. This is a 17-year-old girl that I've known for about a year. Dear Dr. Robert Cywes, MD, Ph.D., first and foremost, the words thank you aren't enough to describe how truly grateful I am for the experience you provided me and the lessons I have gained. Starting with our first encounter in January of 2022, I was scared and nervous about starting this health journey. But you reassured me that as long as I stayed committed, I would gain something incredible, and you were right. Not only was I able to get healthier, and start taking better care of myself. But you taught me the most important lessons. Nothing gratifying is easily gained. It's hard work. And it takes dedication, motivation, and self-respect to go out and get what you desire. You also taught me how to love myself, be comfortable with who I am, and yet to continue growing who I want to be. And you showed me that how you feel on the inside helps to radiate your beautiful outside. In all, once again, thank you doesn't cut it for how appreciative I am, but thank you. And I will never take any of what you have taught me for granted, but more importantly, use it to continue to expand my and others' knowledge of this journey. That, folks, from a 17-year-old kid. Someone who's made the investment, who's putting in the hard work, and is doing amazingly well. And this person, this woman, is doing well, not just preventing the harm that otherwise would have happened to her, not right away, but in her 30s, 40s, and 50s. So prevention is far better than treatment and disease removal and disease correction. Preventing those diseases at this early age is far more effective and far more valuable, because when you're in your 40s, that time between 17 and 40 or 50 is history for us. It's history for me. It is her future. So she can still define her destiny, define her future. Mine is lost. Her future is my past, and that past is history. One of the reasons it's so important to have our youth and have young people buy into this and begin to change is because of prevention, because it prevents you from having all those problems that you then have to deal with when you're older. Or perhaps when it's too late, after that first heart attack, after your stroke, it's too late. But prevention is the most difficult thing to see, because the absence of something, rather than the correction of something, is so much more difficult to do. But the second thing you can see from this letter, and I can tell you personally, having met this young woman, when I first met her, she was insecure. Her mental health was one of self-degradation, of insecurity, of anxiety, of stress, of depression. She had no coping strategy. She had no coping mechanisms. She was hard on herself. She was inadequate. Her sense of self was in the toilet. And that is so true for so many of our youth. And then they turn to addictive substances, to instant gratification substances, whether it's carbohydrates, whether it's vaping, whether it's disruptive behavior. All of those are dysfunctional coping strategies. And as part of this young woman's journey, we are starting to have her understand and then practice and practice and practice on a daily basis until it just becomes who she is. Forms of effort-based emotion management that help to resolve her mental inadequacy and gives her the strongest mental health that she can have. So the value of our youth doing this is for prevention of disease. Difficult for them to understand that. So they've all got a big S on their chest. They all wear their underwear on the outside. I am Superman. I am Supergirl. I can fix this down the road. Talk to my 40 and 50-year-old patients. Ask them how easy it is. But the mental health component, folks, the mental health component of dealing with substance abuse and addiction and restoring your sense of self, your self-esteem, your self-confidence, your self-respect is enormous. And if you can get this in your teens and as a young adult, you're going to be way, way ahead of the game. Particularly when it comes to carbohydrates, the other issue, and this is what people don't understand unless it's retrospective, is that a strong relationship with carbohydrates has a significant independent effect on cognitive impairment. In young women, age 23 with polycystic ovarian syndrome, a guy by the name of Steve Cunane did a study on this, and he was able to demonstrate measurable mild cognitive impairment in 23-year-old women who had polycystic ovarian syndrome. That's the beginning of Alzheimer's, folks. That's the beginning of brain deterioration. You're losing brain cells. You haven't reached that critical threshold that we see as Alzheimer's, but you are already having cognitive impairment, and those brain cells cannot come back. Thank God we've got a whole bunch of them. But can you imagine if you don't have that problem right now? You've got so many more brain cells available to you down the road to work from a cognitive perspective. So treating mild cognitive impairment at its root cause with brain inflammation, with vascular inflammation related to nicotine vaping and related to carbohydrates is so helpful, is so beneficial when you fix it in a teenager and a young adulthood. So we've got prevention of disease, we've got mental health, we've got mild cognitive impairment. What else are young people concerned with, and what do they abandon and not have that causes tremendous anxiety? Young people are isolating themselves in droves. They've forgotten how to talk. They don't know how to listen. They don't know how to communicate. They don't have the skills to build human relationships. And human relationships can be done by texting, but that's a surrogate. It's a surrogate for the anxiety and the stress and the fear of having direct human connection. So a large part of our program is to help young people to develop empathetic human connections, where they learn to trust people, not be afraid of people. They learn to trust them. They learn to use relationships with other human beings as a way to be vulnerable and connect through the medium of vulnerability. But you can't be vulnerable if you have a poor sense of self. You cannot be vulnerable if your self-esteem is in the toilet. So helping a young lady like this to develop skills and to develop strategies where she can build relationships, where she can communicate, she can talk with, she can listen to other people, she can connect with them at a humanistic level, which ultimately makes us the social animals that we are. And healthy relationships, whether interpersonal relationships with a loved one, whether relationships at work, whether relationships at play, whether relationships in sport, relationships give you the ability to be part of a team, to learn from others, to do things collectively, as well as in isolation. Relationships make us better human beings and a better species. And health, folks, biologic health. Biologic health that is mediated through a very, very low inflammatory state. Less cancer, less fatty liver disease, less Alzheimer's and brain disease, less neuropathy, lower risk of a heart attack, lower risk of obesity, lower risk of diabetes, lower risk of infertility, better risk of having healthy babies, better risk of having healthy babies' brains. Biologic health, by reducing inflammation, by reducing insulin resistance, by reducing hyperglycemia, by reducing hyperinsulinemia, because of how we manage our lives. This woman, this young girl, hasn't even recognized that she is not going to have as she gets older. It is a natural phenomenon that we accept, that we're going to have hypertension, we're going to wear down, we're going to have joint issues, we're going to have knee issues, we're going to have ligament issues, we're going to have arthritis. All of those things are accepted as part of the aging process. But folks, those are a direct consequence of inflammation. And if the body is not inflamed, you don't have those wear and tear injuries. I was talking to someone who calls herself the Black Carnivore. And she showed one of the most powerful slides out there, that African American people are indoctrinated with a belief that they're going to have diabetes, they're going to have hypertension, they're going to have obesity, they're going to die early because they're African American. And that's absolute bullshit. It is about the indoctrination at a very, very early age of dysfunctional emotion management systems that our society foisters on certain ethnic and cultural groups. But nobody has to believe that that is their destiny. And if we can get our youth involved to understand this, if we can get our young people to have that aha moment as they plan their careers, as they want to go to college, as they want to get that vocation, as they want to have that family, as they want to have those relationships, as they want to have that job and that wealth and be successful, the cornerstone of success for a young person is who they are. Not how smart they are, not how much money they have, but who they are as human beings, how healthy they are psychologically, mindfully, and biologically. And the investment can be made very, very early in our youth. But they have to understand that. Because the most valuable, the most precious commodity that any human being can have, and it cannot be sold, it cannot be bought, cannot be given away, cannot be acquired, and that is youth. And if you leverage your youth to be the healthiest person you can be, you're far more likely to be successful long term. And more importantly, if you can be successful in terms of mental and biologic health as a young person, you're going to break the generational trend that leads to a vulnerability to addiction across generations. Because we get raised a certain way, we become that person, and the best we can actually do is to raise our own kids the same way we were raised. Unless, at a very early age, we change who we are. We change how we manage our lives. We choose health. We choose the hard work, where the reward is mindful, psychologic, and physical health. And if we can break that trend as a young person and be that different person, then our children will be that different person as well. And we've severed and we've broken a worsening generational trend toward mental health, toward biologic disaster. And yes, as a parent, we can tell our kids they must or they should or they have to, but there's no way they're going to listen to us. They need to discover this themselves. They need to make this choice. And this young girl was exposed to what we did, and she was afraid, she was scared, she was frightened by starting, but she did, she engaged. And in little baby steps, that taught us making those little baby steps. She's gone from being this insecure, afraid, anxious bundle of nerves and withdrawal to being this exuberant, wonderful, caring, relationship building, working on her own success human being. Does it mean she's not going to get knocked sideways? Of course she is. Does it mean she's got resilience? Of course it does, because she has tools in her emotion management toolkit that are creating from someone who is dying on the vine to being a survivor. And no matter what life throws at her, she'll roll with it, she'll get herself up, she'll dust herself off, and she will survive and continue to work on survival. Folks, I wish more than anything else to be able to be more functional, to be able to use what I do and what I know with the youth, with the people that don't understand what it's like to be 40, 50, 60, 70, and now having to deal with something that you've been your entire life. One of the decisions that we made, my wife and I, who've gone down this journey independently and together, is to raise our child this way. Not only with his diet, not only is he primarily on a carnivorous diet and a non-carbohydrate diet, but more importantly, to raise him in a way that he is effort-based in terms of his emotion management, praising the effort, not the outcome, but creating structure, not overly cluttering him with structure, but creating structure within which he is safe, within which he can thrive, within which he is positive, within which he is confident, within which he is happy, within which he derives emotional satisfaction from what he is doing, the pleasure and the fun of what he's doing, not just his accomplishments. Because failure is as much a teacher as success. And we let him fail, we let him struggle, but we praise him for the effort he puts in, because that's how you learn to be a confident person. We've chosen that for our son. allow us to help you to get some understanding in this if you are in your teens, in your 20s, in your 30s. If you're a parent of a young child, set up a visit so we can talk about some of the strategies. So the final thing to remember as a parent, you cannot raise your children by telling them what they should do. You can only raise your children by being the person you want them to be. I am the Carb Addiction Doc. This letter influenced me so much because it tells me we can. It tells me if the youth choose, they can be that better person. Please hit the like button, subscribe to our channel, have your kids watch this video if you choose to, watch it with them, inspire them. You can't do it for them. Set up a visit for them with us. But don't force them to come. They have to choose to come. Because if they're here because of you, they're not going to do this. If they come in because they want to learn, they're anxious, they're apprehensive, they're afraid, but they want to see the other side. Show them this video. I am the Carb Addiction Doc. If you want to set up a visit, 561-517-0642. Call, text, WhatsApp, leave a voicemail. We'll get back to you and set up the visit.